The issue of pricing for therapies which are administered once or very few times and give a lifetime of benefit is a complex question. And on the one hand, there's a number of companies that are going to be facing this question before we're there. So various, I know Bluebird is with their Lentiglobin, is going to have to face that question. Obviously, you have various pricing models that come out with gene therapies, Luxturna, which was just approved from Spark, and so on. So your basic pricing models are basically one larger upfront payment or some sort of amortized payment where there's you pay for continued benefit and things like this. So I think a lot of that still has to be worked out in terms of the sort of reimbursement models, and I think the reimbursement models are going to be related to the pricing models as well. So that's a question that, so generally how it might turn out is a question that's hard to answer. Obviously, we're in the business of genetic disease. There's a lot of, there are more prevalent genetic diseases, and then there are also very rare genetic diseases. We're actually quite keen to get to the point where our therapies are so well accepted and have had a good safety record that we could go to regulators and talk about conditions where there are 100 people in the US and 50 people in the US with defined genetic diseases, where we know we could treat them, regulators know we could treat them, but the model for how you would do that when there are so few patients, it has to change in some way. And we have to at least come to some kind of understanding that if we want to go after this, how are we going to do that? And that will also feed into the obviously the cost equation as well. Because if you can get through the process more efficiently, that should slant in the right direction for costs as well.
And insurance companies in the U.S. probably have no idea that what's about to hit them.
They're learning, I think. I think with the debut of Luxturna, I think that is certainly something. Strimvelis was approved, at least in the EU right now, and Glaxo is marketing that, or at least it was up until recently. So, single-payer systems may have more of an advantage in this area than in the US, where it really forces the different kinds of insurance companies and people move from one to the other, and how you would track that patient, and people obviously also have the right to drop off the grid and not be insured, and what happens in those cases. So these are complex questions, I think, in the US, and I know that insurers are definitely aware of this coming wave. Now, it's not about, there's not going to be a tsunami next year in terms of so many of these things, but as the first few come through, they're going to have to start addressing this, and I think they're aware that they're coming.